The reality is, if you're losing your hair, you're not looking to spend years to get up to your treatment. You
No.
want to get the treatment started now. So what do? You see a hair expert. Again, in my case, I'm going to say come to Bosley, see us. Hair experts have treated enough people with those medications that we
Yes.
can layer them all on. You're not going to end up with too much hair. No one's going to come back and say, "Hey, can we pull back on one of these medications because
Right.
I'm having trouble combing my hair."
Yes. From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Trelord. This episode of Care Experts is brought to you in partnership with Bosley, the world's most experienced hair restoration expert. Hair thinning, shedding, breakage. Changes to hair are incredibly common. But when does it become something worth treating? And more importantly, what can you actually do about it? Today, we're joined by Dr. Ken Washenik, Chief Medical Officer at Bosley, one of the most recognized names in hair restoration and a leader in non-surgical hair loss treatments. Dr. Washenik is also a faculty member of the Department of Dermatology at the New York University School of Medicine and has spent decades researching how to preserve hair and promote healthy growth using science-backed solutions. Whether you're just starting to notice changes or ready to explore your options, this episode is packed with insights to help you take a smarter, more personalized approach to hair health. Dr. Washenik, welcome to the Care Experts podcast.
Thanks so much, Erin, for having me.
What can people do early on to prevent hair loss? Let's talk about some of the non-surgical options that are going to support regrowth or prevent hair loss in general.
So early on, I think a really important concept to get across to people is if you think you're losing your hair, you are. And you should treat it as early as possible.
Mm-hmm.
And so you should go to a specialist, go to a hair loss specialist, come to Bosley, get a free consultation and find out why you're losing hair. What's the diagnosis, right? You can arrive at that from a careful scalp exam, looking at your hair. And if it's inherited hair loss, then we have approaches that you can take. If it's not, if it's some other reason, you want to avail yourself to the correct treatments. So treatments for male pattern hair loss are not going to be the same as those for alopecia areata or other autoimmune diseases. Or if you're taking a medication that causes hair loss, you need to stop taking that medication, not just treat it like it's male pattern hair loss. And so that's where you really need a diagnosis. You need to see a hair expert. You come to Bosley, get a consultation, find out why you're losing it, and then you'll know which of the treatments is best suited for you that give you the best shot at success.
Can you tell us a little bit about a prescription or prescription options that are available and who those would be right for?
Yeah, so there are a good number of prescription options, thankfully. And so we have drugs that approach, that inhibit the androgens that we talked about. So there are drugs out there like finasteride and dutasteride, and there are drugs that we have used to treat women's acne and excess hair where they didn't want it. Spironolactone is one that exists. Minoxidil has been a topical preparation. Now it's very popular to take minoxidil orally instead of just rubbing it on your head. There are important and effective prescription medications. Then there are things that you can get through your physician, like PRP, platelet-rich plasma, right? So you can take advantage of the growth factors in platelet-rich plasma, and obviously you have to do that at a physician's office so that because they draw your blood, they concentrate the platelets, and then they inject those back into your scalp in the areas of thinning hair so the growth factors can drive growth. Then there are things you can do that are not prescription, right? The red light laser caps, LED caps. So the red light, a lot of people talk about red light. I mean, red light is very topical and trendy right now.
Very.
But it turns out that it's been a winner for treating thinning hair for a good long time now, and it does work.
So those red light masks that my friends and I are all walking around the house looking like funny creatures from another land. Could you technically put that on your head?
You
And
can.
it's
Red
the
light.
same red light. It's the
Yeah.
same idea.
Red light. So, the facial ones, sometimes you'll see blue light and red light. The blue light helps with acne, and red light does other rejuvenation aspects. But so a red light, and maybe this is too technical or that people don't care, but like 650 nanometers, 660 nanometers. So essentially, visible red light stimulates hair follicle growth.
Wow.
And so it is good. I mean, whether or not you want to flip up your mask or just get something store-bought for your head. At Bosley, we have the Revitalizer, which is a cap that has red light lasers in it, and it's very helpful for hair loss.
And how long are you using that cap? Is it daily for?
Yeah, minutes each day. Yeah, some people like to use it every other day for more minutes, but you can use it every day for just a few minutes. It's a pretty easy treatment to fit into your lifestyle. You could be doing your emails. You could be cooking dinner.
It's one of my favorite parts of the day.
Texting the daylights out of your fingers and treating your hair loss at the same time.
Amazing. Are there any topical treatments, shampoos, conditioners, that type of thing that are shown to help with hair growth?
So it's a great point, and I want to step back also a little bit with the treatment, the prescriptions.
Yeah.
So one of the big advances that has happened, especially since COVID, when you couldn't go to your doctors, is there's telemedicine.
Yes.
And so you could avail yourself to telemedicine. You can go to Bosley RX and without even going into a doctor's office, be diagnosed and prescribed prescription treatments.
Wow.
Without leaving your home. So that's a very good option. So that's prescriptions. Now, as far as non-prescriptions, so shampoos, conditioners, things that you put in and rinse out, they haven't been shown to help hair growth. But what I don't want to underestimate, you mentioned before hair breakage. Hair breakage is important. It's not important for me. My hair's short. I'm cutting it off. I mean, it wishes it had a chance to break. But if you have long hair, I mean, someone with hair that's your length, I mean, you have to guard against breakage because you could lose a lot of hair with absolutely nothing wrong with the roots by having breakage. And that's where shampoos and conditioners and things that decrease breakage, decrease friction, enable combing and brushing without breakage are very important. Then there's a separate category, and it's a category I use all the time, and those are thickening shampoos and thickening conditioners. They make your hair look thicker. They don't treat your hair loss.
Right.
But while you're treating your hair loss, you might as well pump it up with some volume at the same time and buy a thickening shampoo. Because at the end of the day, you want to look your best. You want to feel confident about your hair. Treat the underlying problem and then help pump up what you have on your head right now.
Absolutely. You touched on PRP. Is that the same as microneedling or dermaplaning?
So different. No, but the reason that question would come up is they're often used together.
Ah, okay.
All right. So for facial rejuvenation, you hear people talk about like the vampire procedure, right? So
yes.
so they'll put platelet-rich plasma on, and then they'll microneedle to help the platelet-rich plasma penetrate into your skin. And so you can also do that on your scalp. And you can do microneedling even without PRP. Like microneedling has been shown in conjunction with minoxidil use to increase the benefits from minoxidil. So an easy thought is, I'm increasing the permeability. I'm opening up the barriers in your skin, right? Your skin's a pretty good barrier of stuff. That's one of the purposes of it. So with microneedling, you could be opening up that and letting some helpful substance in. But really interesting research has shown that that little bit of microscopic damage from microneedling, and there are some lasers that do that now. There's a laser called a Folex laser. Good name for something that treats follicles, that makes micro tunnels in your skin like microneedling does, but the laser doesn't even break the surface of the skin. And then as your body closes up those little channels, it releases growth factors. So it's closing those up, it's healing those little channels, and oh, by the way, the hair follicles around them are stimulated to grow. So, to come back to your question, there's PRP, there's microneedling, separate things, but they also help each other out. They're synergistic.
Do you recommend doing some of these treatments together? Do they work well in conjunction with one another, or would you kind of recommend trying one thing at a time?
So, trying one thing at a time is very sensible, and you see what's working, and you see if you're having a side effect to one medication before you layer another one on. However, the reality is, if you're losing your hair, you're not looking to spend years to get up to your treatment.
No.
You want to get the treatment started now. So what do? You see a hair expert. Again, in my case, I'm going to say come to Bosley, see us. Hair experts have treated enough people with those medications that we can layer them all on. You're not going to end up with too much hair. No one's going to come back and say, hey, can we pull back on one of these medications because
Right.
I'm having trouble combing my hair.
Yes.
So I really think, multi-modality treatments, which is technical thing for throwing the kitchen sink at it. You want to use treatments that have different mechanisms of action. So minoxidil is a hair growth stimulator. It's just like pressing on the gas pedal on your car. Finasteride, spironolactone, dutasteride, they help remove the inhibitor. So they're like making your car go faster by taking your foot off the brake. So now you put on a growth factor,
Yes.
like minoxidil or platelet-rich plasma, and you remove the bad guy, the DHT, the androgen with finasteride, dutasteride, spironolactone, and now you're really helping yourself. Like we see that when you do medication, pharmaceutical studies, you do one at a time because you want to know exactly what this is doing. You want to be confused by the background.
Of course.
But after they come out, we find in clinical medicine combining things that have different mechanisms of action. So that's great because they don't have cumulative, they don't add up their side effects, they don't cancel each other out, but they're synergistic, they're additive in their benefit. And so, yeah, I mean, the bottom line is I got a bunch of stuff on my head right now, and I'm going to keep doing it.
Whatever it takes. What should patients know about customizing their treatment plan?
Every patient should see an expert.
Yeah.
And again, I always say come into Bosley, you have a free consultation, but you can do telemedicine. Go to Bosley RX. And so then you can personalize your approach because then you have a diagnosis, you know why you're losing your hair, and that menu is a different menu than there would be for a different type of hair loss. And you can personalize it. I mean, I'll use the example of minoxidil. I mean, I've been doing it for decades. Minoxidil topically has been out since the late 80s. But some people don't like rubbing something on their head. They just don't. I mean, I want my hair, but I don't want to rub something on my head.
Yeah.
And so then they like taking the oral pill for minoxidil. So again, personalization is just that. Personalization. It's taking into account the needs of that person. Doesn't do you much good to give someone minoxidil if they don't want to rub it on their head and they won't use it.
Right.
It's like giving them toothpaste that they hate the taste of and they're not going to brush their teeth.
Yes.
So you want to do something that a person's going to be like it's an ugly medical term. I mean, it sounds to me too, overbearing, but compliant. You want someone to want to do their therapy because then they're going to keep doing it. It's like a gym membership. If you buy the gym membership and you don't go to the gym, it's not going to help you. So it's the same thing with these treatments.
I have some great questions from our listeners for you for Ask Me Anything portion of the show. The first one is, can I use microneedling for spot treatments, or do I have to get it on my whole head?
So that's a great question. And the reality is, let's talk about male pattern hair loss. So if you have like a balding spot in the back, would you just do that? You could. But my guess is you also have miniaturization in other areas, and I would use it throughout the male pattern area.
Mm-hmm.
And your physician, your provider can look and see where you have miniaturization and use it and do it everywhere. We do treatments for people who have localized alopecia areata, which is an autoimmune disease, and you can treat the individual spots
Okay.
that they have because that's a different process. But for male and female pattern hair loss, you want to kind of have a field effect, not just a spot effect.
That makes sense. I've heard PRP can be used to regrow your nails and hair. How much growth can I expect, and can it be paired with a transplant?
So when you do hair transplantation, you want more hair where you want it.
Mm-hmm.
And what you also don't want to do is you don't want to keep losing the hair in the areas you were losing hair. So whether it's platelet-rich plasma or red light laser or LED therapy or minoxidil or finasteride or spironolactone, absolutely combine those. Transplant the hair and then fight the hair loss in the other hair. Thankfully, the transplanted hair does just fine by itself, but it's the hair around it that you haven't touched that's still susceptible to thinning and loss.
Mm. I wear my hair in a slick backed bun 2 or 3 days a week. I've heard this can cause hair loss. Is that true?
So it is true.
Yeah.
I mean, unfortunately. So, 2 or 3 days a week in a ponytail, you're going to be fine. But there are some people who put enough tension on their hair that it's painful.
Mm-hmm.
And then you could end up with something called traction alopecia. So, hairstyles where you do, tight braids
Yes.
or tight ponytails chronically over time can lead to hair loss. And at least in the example you gave of a ponytail, it can give traction alopecia in a marginal at the edges. So along the front hairline,
Right.
you'll see thinning hair. Now, if there's any saving grace with that, traction alopecia does very well with hair transplantation. At Bosley, we see a good number of patients, women who've come in with traction alopecia, and in that area where they've lost their hair follicles now, there's not inflammation, and you transplant in good hair follicles and they grow wonderfully.
Amazing. Are there any lifestyle changes that can help support hair regrowth or just stop hair loss?
I would say the most important lifestyle change or maintenance of a habit is good nutrition.
Yeah.
Avoiding things that starve your body. If you starve your body, you starve your hair. Earlier, I mentioned iron. If you're low on iron, you want to make sure you top that up because that's an important cofactor for hair. There are a bunch of them. I mean, copper, biotin, zinc. So all of those. I mean, any lifestyle idiosyncrasy that you do that would lower those is not good.
Mm-hmm.
So whether it's dietary or medications that interfere with those, you want to avoid those.
Can stress in general, like say you have a stressful job, can that cause hair loss?
There's laboratory research that has shown that the chemicals elaborated by cells when they're under stress can have a damaging effect on hair growth. So that has been shown in the laboratory. So that would imply that if you can control stress, it would be great for you in so many ways, but can also help your hair.
Okay, amazing. So everyone take a few deep breaths on that note. The last one is I wear a hat every day to hide how thin my hair is. I'm going to start some non-surgical treatments to help regrow my hair. Can I still wear a hat while I wait for my hair to grow out?
100%. You don't have to stop wearing your hat.
Really?
Yeah, just find one or several that you like.
Yeah.
And you asked about how often you should wash your hair. You should also wash your cap periodically.
Mm-hmm.
But no, you can wear it. Yeah, it's not going to interfere with the treatments. I mean, none of the prescription, non-prescription treatments that we talked about. If you've had hair transplantation, go ahead, put your cap back on. The hair's going to grow just fine.
I have a personal question as a mom and as a woman who has a lot of friends who are moms. Many of us, after having babies, noticed significant hair loss. Now, for me, that has come back. Is that just hormonal or what's happening in
It
that?
is that is a really unfortunate thing. At the happiest time in your life, you're noticing that your drain is plugging up, and you're like,
Yes.
"Holy macros! I've got this baby, and now I've got this hair issue." And so it actually has a medical term. It's called a telogen effluvium, and that's a fancy couple of words for shedding. And your body has built up this hormonal milieu, this environment of hormones to help support your baby's growth.
Yes.
And then when it's over, your hormones go back to normal and your hair's like, wait, what happened? And so there is this period of time, and telogen effluvium, this shedding, lasts for a period of months and then comes back. And it is interesting because sometimes people will go through that and they'll say, well, should I use some minoxidil? And I'm like, well, first of all, I always like treating hair loss, but the reality is the time period for that to kick in would be about the same time period that your hair would come back naturally.
I see.
I'll tell you one important consideration. So yes, it returns nicely after a few months, postpartum effluvium or shedding. However, whenever you go through a shedding period, if you have a genetic propensity for hair loss, it could advance that process.
Right.
So something that maybe a couple years later would have been your thinning hair situation could now be sooner. So everyone doesn't 100% recover from that. But if you don't have hair loss, your hair will grow back nicely.
Okay. Amazing. Well, thank you so much for being here today and sharing your wealth of knowledge with everybody. It's been a pleasure.
Well, thank you so much for inviting me to talk about my favorite topic, hair.
Thank you to Dr. Washenik for joining us on Care Experts and sharing his expertise on non-surgical hair loss solutions. We appreciate all the insight, and thanks to everyone who tuned in. This episode was brought to you in partnership with Bosley. Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.